and welcome to the Dr. Bob Show. The leading cause of death in the United States is cardiovascular disease, heart attacks and strokes. What causes those? Is it blood pressure? Is it something wrong with the arteries? Is it cholesterol that's causing the problems? We'll be spending most of this show talking about cholesterol and how it's involved with high blood pressure, heart disease, and strokes. My guest is Dr. Josh Todd. Dr. Todd is a board-certified cardiologist, heart specialist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about exercise, nutrition, sleep, and laughter, and how those things also affect your heart health. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Josh Todd, board-certified cardiologist, and we're going to be talking about the leading cause of death in the United States, cardiovascular disease, cholesterol, and where that's involved. Josh, welcome to the Dr. Bob Show.
Thanks for having me again, Dr. Bob.
First of all, what is a heart attack like? What symptoms do people have?
Yeah, I wish most patients would read the book on this, but it's probably 30 to 50% of patients will follow a book. But it's a sudden onset squeezing or tightness in the chest. People, to me, described it elephant sitting, or their chest is in a vice grip. Often with these sudden heart attacks, there is associated symptoms. Shortness of breath is extremely common, nausea, sweating, generalized fatigue, but it's all pretty sudden with the heart attacks that people come emergently in the hospital for.
Is most of the time when people are having a heart attack, do they know something bad? Is intuition saying something's wrong? Yeah,
and we divide our heart attacks into the ones where they have 100% blocked artery. Those are the STEMIs, which stands for ST elevation myocardial infarction. And those have 100% artery. They need to go to the lab right away. The other kind have more of a slow growing plaque, or maybe a plaque that was occluded and then opened back up. Those patients may have symptoms that are short term and then relieve because that artery is open again. I would say that most patients that have the STEMI, the bad heart attack, know right away, and it's not subtle. The other type of heart attacks can wax and wane over a period of days.
The people that are having the STEMI, the urgent care, it's very, very important that we get that person to the emergency room, to the cath lab. Why?
Absolutely. So about every 30 minutes we wait on a heart attack, there's an increase of 8 to 10% mortality. And we say time is muscle. So the earlier I can get in there, open up that artery, the more heart muscle is salvaged. And heart muscle, like brain tissue, is not one of those organs that can regenerate itself very easily. So once it's gone, it won't come back.
When somebody has a heart attack, no blood nourishment to a certain part of the heart, that muscle dies. Is it easy to reestablish that, or sometimes you don't, as you just said?
Yeah, I would say 95% of our patients that come in with those STEMIs, we don't have any issues revascularizing or putting in a stent to open that up. Usually it's a soft clot, and as long as they've come in within 12 hours, it's pretty easy to open those arteries up. And you know, from the time they hit the table to artery open is usually about 15 to 20 minutes nowadays.
Which is amazing. When I came into practice, they didn't do anything like putting in stents and reestablishing a blood flow. When you're doing the cath and you're reestablishing blood flow, does the heart get irritable at that time? Do you start having rhythm problems and you say, uh-oh, let's get to work?
Absolutely. That's why the critical care unit was invented, is to be close to electricity. So anytime we wake up these cells, they're in different stages of getting rid of electricity and kind of repolarizing themselves, and that instability in heart cells doing what they want to do is what really causes the arrhythmias. But very common. We always have pads on patients, and probably about a 15% time we have to electrocute people on the table.
It must be interesting to watch that blood flow reestablish itself.
Absolutely.
And and the changes. Can you see the changes in the electrocardiogram
Can,
go
and
from
we always have
real
to
bad to better?
Yeah, absolutely. Blood pressure will come up. Patient feels a lot better. The grayness, the patient's obviously in pretty bad distress during that time. So it all is fixed within a matter of 10 to 15 minutes usually.
So with a heart attack, we now call it acute coronary syndrome, and the problem has to do with not enough blood supply to certain parts of the heart. Is that because of cholesterol usually?
Yeah, and the cholesterol plaque is this slow growing crud, for lack of a better terms, in a pipe that can narrow it over time. The rate at which that occludes, if it's over a matter of minutes, that's heart attack. If it's over a matter of years, that's when we have angina terms, or I exert myself and I get chest pain type symptoms.
So what's going on with angina? Why does the rusted pipe not being completely blocked, why does that cause chest pain? What's going on?
Yeah, so the heart's probably one of your most active organs. In fact, it is the most active organ. It's always beating. And uses a lot of oxygen. Unlike a leg artery that can be blocked, you may not notice it until you get up and move around. The heart's one of those organs. If it doesn't get blood flow, it knows pretty quickly.
Yeah, and that's a good warning sign, the fact that people do have angina.
Absolutely. Yep.
Most people recognize angina?
Yeah, and again, it depends on the onset or how fast that cholesterol plaque narrows. Early in the angina course, it's usually when they exert themselves, exercise, do yard work, housework. The exercise pain gets worse, they rest, it gets better. In late stages, when that artery gets to 90-95% blocked, we can have some rest angina or angina that people have.
Same type of pain that they're having with a heart attack, pressure pain behind the breastbone, sometimes radiates, short of breath, weakness, sweating, that can go along with angina also.
All of that can happen, and again, because the artery is not 100% blocked, you don't get the sympathetic or that adrenaline surge that you get with one of the heart attacks where the artery is 100% occluded. So milder shortness of breath. You may not feel sweaty, and when you relax and sit down or take some medicine for it, nitroglycerin, that can alleviate that blood flow blockage for a short period of time, and so symptoms resolve quicker.
Is angina easy to overlook? Can a patient have gas, heartburn, fullness, not worry about it? I'm thinking specifically of an excellent athlete who had some chest discomfort and went to the track to run it off. And as he was running, he died.
Absolutely. Everybody's check engine light is a little bit different on how they feel angina. And so, we take a look at the whole patient. So your risk factors, your family history, are you diabetic? Do you have uncontrolled high blood pressure? And take that into account into the story as well. I don't think any cardiologist is good enough to predict based on one description of chest pain that's 100% that is, because the atypical nature of coronary disease is pretty tough to predict. That's why we have testing.
When we have a coronary artery that becomes blocked or becomes diseased because of cholesterol, what's the cholesterol doing?
So cholesterol is it's floating around the body. Okay, there are different types of cholesterol. There's HDL, which is your good cholesterol. I like to think of that as the cholesterol going from your arteries back to the liver. Your LDL, the bad cholesterol, which goes from the liver out to the arteries. And over time, as we get older, and environmental factors, genetic factors, dietary decisions that we make, those arteries, which are supposed to be clean pipes, just start to collect this cholesterol plaque, and it gets more narrowed over time.
So is there anything that we can do if somebody's got cholesterol that's narrowing the pipes? Is there anything we can do to help that?
Yeah,
and that's what we're going to be talking about when we come back. Yeah, there is some things that we can do. And we need to learn where cholesterol is involved in our lives to see if it needs to be corrected, and it can be corrected. We're talking with Dr. Josh Todd, board-certified cardiologist. We've been talking about what a heart attack is like, what the symptoms are like, what's going on with the blood vessels that supply nourishment to the heart, why it's important if you're having chest pain that we get to the emergency room quickly. Some heart attacks are more dangerous than others. They're all dangerous, but the treatment and the establishment to re-establish circulation is different from different vessel disease. We're on cholesterol, and we were talking about HDL and LDL. Let's go back and teach me a little bit more about what is HDL and what is LDL and why are they important and what are they doing to help the heart or hurt the heart?
Yeah, so people, when we start with cholesterol, everybody looks at their total cholesterol number. And historically, we got nervous about total cholesterol numbers greater than 200. We've since found out that there are other particles, that they're different shapes and they have different mechanisms within the body. HDL, we like that. That's the good cholesterol. Again, as I described it, it's usually the cholesterol that's going away from the arteries back to the liver.
So what's it doing, the HDL? Why is it good?
So we know that it's protective of heart attacks. The higher that number is, the better off you're going to do, the lower risk you are of having heart attacks and strokes.
If you've got a good HDL, does that help the coronary artery that's been rusting, the rusted pipe? How does the HDL help that?
Yeah, usually it's a prevention level, so that most of the time it's not that it takes away the plaque, it's that you prevent yourself from having that plaque. We can't treat HDL too well with pills, however. It's better with exercise and diet. That seems to have more long-lasting effect with HDL versus its close cousin LDL, which is the bad cholesterol.
So the LDL, the bad cholesterol, what's it doing to the pipe?
Yeah, and that's the cholesterol going from the liver, being manufactured, going out into the body, and that's what's rusting your pipes.
Okay, so that gets inside of the blood vessel, forms cholesterol plaques that are in there, and that's the hardening of the arteries.
Yes.
Does that occur just in the heart arteries, the coronary arteries?
Yeah, it's again, the vascular tree is throughout your entire body. So we see it in the legs, we see it in the aorta, we see it in the heart, we see it in your head. And so vascular disease is a systemic disease, not just a one organ disease.
So when it's going on in the lower extremities, going on in the legs, what are the symptoms there sometimes?
Yeah, we call those symptoms claudication. Claudication is like angina for the legs, but it's usually calf cramping or aching when people walk up hills. If it gets more progressive, the entire leg can start to ache as well.
And if they're exercising and start getting leg cramping, when they stop and rest, it gets better until they start walking again.
Exactly.
What does that do around the kidneys and some of the other organs? Does the blood vessels go into the kidney, do they get diseased?
Yeah, they can, and that's what can cause earlier progressive kidney dysfunction or kidney failure, is cholesterol plaques in the teeny tiny capillary area. So patients with uncontrolled hypertension or diabetes, that's a stronger predictor of atherosclerosis, do have higher rates of kidney disease as well.
What's going on up in the head?
Yeah, strokes are common too, and so again, this cardiovascular term that we use, the good news is that how we treat them all is the same mechanism. We can stent head, we can get clots out of the head, we can do the same thing in the heart, and we can do the same thing in the legs as well.
So we're really showing a lot of advancement on getting rid of the rusted pipe, correcting the rust, cleaning out the pipe, working on that. Tell me about cholesterol levels. Do we treat cholesterol levels now like we used to?
No, so we used to take just the level in and of itself and use that as a decision to put somebody on a medicine. We found out that the statins early, there's a little increased risk of developing diabetes if we pick the wrong person too early. And we also know that a cholesterol level in a 20-year-old is a lot different than the same cholesterol level in a 60 or 70-year-old who's higher risk. So we have a scoring system now the American College of Cardiology has put out. You can get it on an app. You can type in ASCVD risk score into Google and calculate it yourself. But if that number is between 7.5% and 20%, we can consider you an intermediate range individual. And that percentage is what is your 10-year risk of having a heart attack.
So is that better than that's better than saying, well, your cholesterol, your HDL is this level and your LDL. So now we're going on the risk factors. So if you get in a 7 to 20 range, where you know you've got to get to work and start doing, what do you have that person do to reestablish good blood vessels.
Right. So the answer always first is lifestyle modification. So we talk about diet and exercise.
So let's talk about diet and exercise. What do you tell people to do about diet and exercise? Because we've got epidemic of obesity. People are too heavy in the United States. We don't exercise enough. We watch television a lot. We work on our computers. We go to an app to tell us what we should be doing, but sometimes we don't do it.
Right.
So how much exercise?
So the minimum amount, people always ask how little can I exercise and still receive benefit, because that's just the way our minds are programmed sometimes. But so the minimum amount of exercise will be 15 minutes a day of moderate intensity exercise, which is walking. Ideally, we get at least 30 minutes a day or 150 minutes a week. So shoot for the 150. Doing 5 minutes a day probably isn't doing much for you.
What if I went out for a walk for 5 minutes 5 times a day, 25 minutes? Is that as good as walking 25 minutes?
Yeah, I mean, it's cumulative. So again, the targets are to hit 150 minutes a week. More activity, if you can hit that target's better than less activity. So yeah, if you need to do it in little spurts, and eventually you'll build up to it.
Do you try and encourage your heart rate to get up to a certain length, to a certain rate, so that it will improve itself? So
there's been no data on what's the optimal heart rate, and I get that question a lot. Partly because a lot of people are on medications, but the heart rate response is so individual that the type of activity level or intensity of exercise and the time at which you do it is more predictive of outcomes than I got my heart rate arbitrarily up to 130.
So let's say you're telling people to go out and walk. Walking is a good exercise. Everybody can do it. Grab some tennis shoes and get out and walk. How fast? How much exertion?
Right.
What kind of hills?
So we calculate this in what's called METs, or metabolic equivalent. And so you can, again, Google or type into browser on, how much activity gives me this many METs. And that MET number is 6 to 10, okay? 10 is doing a 10-minute mile, so that's getting up there, whereas 6 METs is walking at about a 2.5, 3.5 mile an hour pace. And so we want you somewhere in between that for 150 minutes a week.
I'm going to jump in with a trick question. I don't have a trick answer. Okay. But on a treadmill, if you're getting to about up to 3, just 3 miles an hour, is that as good as walking 3 miles an hour?
Yeah, and we get this question all the time about passive versus, you're actually bearing the weight. I think if we're going to go treadmill, you probably do need to add some incline to it, a 2 to 3% grade, which mimics more what you're doing. So a flat treadmill, not as good. And again, you can use that MET calculator. Every treadmill has it to say, hey, have I gotten to that yet? So usually, when we do treadmills, we start with a 6-8% grade and 3.5 miles an hour, which gets you up to 6-7 METs pretty quickly.
Yeah, so we've got statistical data that's making it more difficult on the patient to cheat.
Yeah,
and so you've really no pain, no gain. You've got to do the activity as part of keeping the blood vessels good. And if anything, it helps the HDL go up a little bit.
Absolutely.
And that's what cleans out things and keeps the LDL from causing as much trouble. How about nutrition? The amount of foods that we eat. There's a lot of foods have cholesterol in them.
Right.
Do we avoid those foods or do we not avoid those foods?
Yes, we don't worry as much about cholesterol content in foods now. We've moved forward.
And that's what we're going to be talking about. Not worrying about how much cholesterol is in the food. Is that a change in thought? How long has that been? Well, it's the fact. We'll learn more about cholesterol eating habits when we return. We're talking with Dr. Josh Todd, board-certified cardiologist. We're talking about cholesterol, its involvement with hardening of the arteries, what causes hardening of the arteries, what we can do about it. We started talking about cholesterol in the diet. Well, what are your feelings on cholesterol in the diet?
Yeah, we figured out that the historic low-fat, low-cholesterol diet compared to a newer diet, Mediterranean, the Spanish did a good study called Predimed and compared those two together. We found there were lower rates of stroke and lower rates of cardiovascular events.
With which one?
Mediterranean over the historic low-fat, low-cholesterol diet.
Okay, so Mediterranean diet is predominantly what?
So we try to go to a more vegetable and fruit-based approach. That should probably be your main course, and then we use lean proteins, preferably fish, as a side dish. Snacks are generally nuts, meaning almonds and walnuts, not peanuts. Peanuts are not great for you. Sprinkle olive oil on as much as you can. Even one arm in there that took extra olive oil shot had a lower rate of cardiovascular events as well. So use that as a replacement for butter here, if we can in the South.
So creating a better eating style, all meals, breakfast, lunch, supper.
Right.
Where is the biggest mistake made in eating?
So I think, one, people try to skip breakfast, and we need to eat at least something. I encourage most of my patients to do lean protein in the morning, whether that's egg white or a small chicken breast, and then so that at lunch they're not as hungry and consuming the larger quantities. It's always about quantity in this country now. You can't go out to a restaurant without a triple or quadruple size portion.
The plate's bigger than the person. When you go out to a restaurant, you look at the plate and you say, how am I going to get all of that in my little stomach?
Right.
Your stomach just stretches.
And we figure it out,
So do you think people are doing a better job, or they're still being marketed too much to eat bad foods?
No, I mean, the big push away from fast food, I certainly have seen less of that. The problem with eating healthy is a lot of those foods are expensive, and to go out to a Whole Foods and get the organic vegetables and the organic meat, I mean, you're going to spend 2 or 3 times as much. So it's hard for average consumer to eat that healthy all the time, and there's too many easy, quick choices. So I've sort of liked these meals that will deliver at home that give you the ingredients, and they've gotten relatively inexpensive with some healthy options.
Sometimes pretty much fun.
They are.
I'll take those meals and sometimes cook them with my wife, and it's pretty much a fun family thing to do. What do you consider the most important, or you've got to do them all? Exercise, nutrition, get off the couch, be active, socialization, less stress. What do you tell your patients?
Yeah, it's all the above, and that's where this lifestyle modification comes in. It is a huge category of, yes, get out and exercise. Patients do a lot better when we have some structure to the exercise program. If you can find a friend, if you can socialize with it.
Give me a structure, an example.
So when we have patients after heart attack, we use cardiac rehabilitation a lot.
And with that, you've got a group that comes in and they exercise at a certain rate with a group of people.
Absolutely. We have exercise physiologists that come in and help instruct. But if you don't qualify for cardiac rehab, but the Silver Sneakers or YMCA, anything where people are expecting you to come out and hang out with them, I think encourages, one, to do it, but two, I think you exercise harder when you're around people.
Yeah, there's a great deal with the interaction with other people to enjoy life and to be better and enjoy your exercising, enjoying how you look, enjoying if you're eating better foods and all that. So there's no easy fix, really, is there? It's something that you've got to do all the time. Josh Todd, you're a wonderful teacher. Thank you so much for coming to the Dr. Bob Show and teaching us about what the things that we should be doing. With that in mind, tell me about sleep and heart disease. You and I were talking about it. Where does a good night's sleep come in with heart disease?
Yeah, the sweet spot in terms of trials, it has been 8 hours of sleep. 6 hours, there's higher risk. 10 or 12 hours, there's higher risk. So 8 hours should be your target. Disrupted sleep, like sleep apnea, does increase risk of developing atrial fibrillation, pulmonary hypertension, and uncontrolled systolic blood pressure. Systemic hypertension is also by disordered sleep issues that people can have.
So we talk to people all the time about the importance of a good night's sleep, and if you're not sleeping well, you need to discuss it with your doctor and see what you're doing wrong, because when we don't get a good night's sleep, we don't rest well, we get nervous, we get upset, and our vascular system pays it. So eating also then, your advice on eating is?
Yeah, so again, if you look at U.S. News, which they did, they ranked all the diets. Number 1 is Mediterranean. Number 2 would be DASH, and that was tied with a flexitarian or a plant-based protein diet.
Now, DASH diet is diet against?
Hypertension. So and it's really the avoidance with salt with a lot of Mediterranean components. If you take a look at the top 10 diets, they're all extremely similar with a couple subtleties.
And the bad foods to eat would be the fried, fat, greasy foods.
Fried, bad oils, simple carbohydrates. What I tell people with Mediterranean is try not to eat anything that's white and try not to eat anything that's been through a meat grinder. If you can stay away from those two, you'll do pretty well.
That's pretty good. Meat grinder means processed foods?
Absolutely.
So there's a lot of sodium, a lot of fat in those. And how about socialization and stress? Where do you feel stress comes in with heart attacks, with bad heart arteries, with a bad vascular system?
Yeah, certainly patients with higher stress levels have higher circulating steroid levels or cortisol levels in their body. They have higher epinephrine and norepinephrine rates, and that all increases your risk of having cardiovascular events. That's probably one of the hardest things to tackle, is to de-stress your life, however.
Yeah, well, it really is, but there's so many things that we can do, and I think we're learning more about spending time for ourselves, mindfulness, and being able to sit and think and relax and take deep breaths, little simple things that can help lower the stress level, increase your socialization, your friendship patterns, where you can relax and laugh with each other. We always say laughter is probably one of the best medicines that we can have. Josh, Todd, again, thank you for coming to the Dr. Bob Show. We've talked about the 4 things that we like, and that's exercising, eating properly, 7.5 to 8 hours of sleep, and that laughter in your life, and you've hit everyone like a nail, hitting the nail on the head.
Thanks, Dr. Bob.